I just want to ask you about the spike we're seeing in cases and some of what seems like a lack of preparation in big provinces like Ontario. We're seeing where they're having to dial back now on some of the loosening that they had allowed. So are we repeating some of the same mistakes of the spring? What's going on? How is it possible that places like Toronto and Ottawa don't have the testing in place to cope with the demand?
It's a really good question. It's probably best directed to the province of Ontario. As you know, through the Safe Restart Agreement, we designated billions of dollars to provinces and territories so that they could be ready for fall to deal with an anticipated surge if, in fact, we saw a rising number of infections. I work on a regular basis with Ontario and my Quebec counterparts to make sure that they have the supports they need from both a procurement perspective but also from a fiscal perspective. And we are constantly encouraging both provinces to make sure that they're looking at their processes and enhancing their testing capacity as soon as possible.
Well, what's your response to the fact that that's not there?
It's very alarming.
I appreciate you saying you gave money to the provinces, but honestly, you're the health minister. So what?
Well, I'm a federal health minister. Absolutely.
But what's going on? That's a lot of Canadians are looking at this and saying it's a huge fail.
Well, I think it's a little premature to say it's a huge fail. I think there's an opportunity right now with both provinces, with their medical officers of health, to look at their testing strategies and to make sure that the strategies are appropriate. For example, in British Columbia, which is also seeing a surge, they're not necessarily having the same surge on testing sites, and partly that's because they have a different strategy. So I think the ministers of health in both provinces need to be very thoughtful at this point in time to determine if the strategy that they've chosen is working. I know Ontario is planning on opening up additional testing centres in the days and weeks to come, and we continue to be there to support actually local public health units with other supports that they might need. As you know, and I spoke about this yesterday, I've directly reached out to the medical officer of Peel. I'll be having a conversation with Dr. Etches from Ottawa very shortly. I've spoken just last week with Dr. Davila and Mayor Tory. These are conversations we'll continue to have because we can, at the federal level, obviously support local public health with the tools that they need. But in terms of testing strategy, I think this is an opportune time for both ministers of health, along with their advisors, to take a look at their strategy and determine what more they can do to accelerate access to testing. It's very important as well that people call ahead to testing facilities, that they understand what the criteria are for acquiring testing in their various jurisdictions.
Hi, Minister Hajdu. What about rapid testing? What's the holdup? It seems that other jurisdictions, such as the United States, have approved, rapid testing devices. What's the holdup in Canada?
Well, I appreciate you using the United States as a comparator. I mean, I think what we want to make sure is that when we approve rapid testing, that we have a degree of confidence in their accuracy. So the last thing I would want to see as a federal health minister is a test that only had, let's say, 50% accuracy, and people are accessing a rapid test and then assuming they're COVID negative, but in fact they're positive, and having that false sense of assurance. My team is working, as you know, at Health Canada with the regulators to accelerate regulatory review of any test that comes forward, but I, of course, want to make sure that we do that in a very thorough and rigorous way. I think there is an actual risk to approving tests before we can determine how they'll be used and what populations and what safeguards will be in place to make sure that they're truly delivering what we need, which is to determine if someone has COVID-19 or not.
But is the holdup that y'all don't have, Health Canada is not confident enough in these rapid testing devices? Is it the providers of these test devices? What is the holdup?
The holdup is the technology has not accelerated to the point where we have received a test for approval that has an accuracy to the degree that we believe it is prudent to allow it into the Canadian market. Now, having said that, I will just also say that I'm putting together now a testing expert advisory panel that will help us look at combinations of testing strategies. But I will say this, we will not at Health Canada approve a test that in any way endangers Canadians' health. And I will say that tests that don't have a degree of accuracy to the satisfaction of the regulators can actually create further harms in communities. Can you imagine a scenario where people could purchase a rapid test in a pharmacy, let's say, and it's only 50% accurate? We're just not there yet. We have not had a test submitted to Health Canada for approval yet that satisfies the regulators' concerns around accuracy.